Welcome back wherever you're watching from. In our last video, we uncovered how AI is quietly replacing jobs faster than anyone expected. But today we dive into something even more personal. Your health? What happens when machines start making life or death decisions? This is the future of healthcare, and it's already here. Across the world, hospitals are undergoing a quiet revolution, not with new buildings or fancy equipment, but with invisible intelligence. From diagnosing cancer in seconds to assisting surgeons in the operating room, AI is changing everything. IBM Watson, Google DeepMind, and hundreds of startups are now competing to build the future doctor. Not in a human form, but in code. Let's be honest. Doctors are human. They get tired, they make mistakes. But AI doesn't blink. It can scan thousands of X-rays in seconds. One study showed that AI models could detect breast cancer with 94% accuracy, better than many experienced radiologists. AI is also being used to predict patient deterioration days in advance, preventing deaths before they happen. And in developing nations where there's only one doctor per 10,000 people, AI could be the only doctor they ever see. It's hard to imagine, but we're just scratching the surface. In India, a hospital AI flagged a dangerous heart rhythm. The patient was treated before the nurse even noticed. In the US, AI helped reduce ICU mortality rates by 20%. In Africa, a chatbot called Ada Health is diagnosing illnesses via text, helping thousands without access to clinics. These are not future predictions. They're happening now, and it's happening everywhere. Peter Thiel, the billionaire behind Australia's largest private hospital operator, predicts that in 5 years, every hospital bed will have its own dedicated AI. It'll monitor your stats, spot warning signs, and alert doctors before any problems arise. Soon, AI will know your health better than you do. At Cleveland Clinic, AI is analyzing blood tests to flag sepsis early, giving doctors an extra 12 hours to save lives. At Massachusetts General, robots are helping surgeons remove brain tumors with millimeter precision, leaving healthy tissue untouched. Even routine appointments are going digital. A startup called American Well connects patients with doctors via smartphone, diagnosing everything from flu to COVID-19. And the results are shockingly accurate. One of the biggest breakthroughs came during the pandemic. When supplies were scarce, AI stepped in. In Kenya, an app called COVID-19 Chat uses artificial intelligence to diagnose COVID-19 over the phone, guiding patients to the right care while conserving scarce resources. And it's not just about speed or accuracy, it's also about saving lives. In low-income countries where access to healthcare is limited, this technology could be a lifeline, especially since AI doesn't complain, get distracted, or forget a face. It's always focused, always ready to help. But it's not all perfect. AI models can be biased. They're trained on data from wealthy nations, leading to poor results for diverse populations. There's also the risk of data privacy. Your health records, including sensitive information like genetic data, are gold to hackers. And if an AI makes the wrong call, who's responsible? The company, the doctor, or the patient? These ethical gray areas aren't solved yet, and they could cost lives. The rise of AI in the healthcare industry has undoubtedly brought forth numerous benefits, but it also presents unique challenges. The increasing reliance on AI-driven diagnoses and treatments raises concerns about accountability and liability. If an AI system makes a wrong call, who is ultimately responsible? The healthcare provider, the AI developer, or the hospital? This ambiguity can lead to confusion and hinder the widespread adoption of AI in critical healthcare scenarios. Furthermore, AI algorithms are only as good as the data they are trained on. Biased or incomplete data can lead to inaccurate diagnoses and perpetuate existing health disparities. For example, if an AI system is primarily trained on data from a homogeneous population, it may not perform well on patients from underrepresented groups. This can result in misdiagnoses or inappropriate treatment recommendations, which can have serious consequences for patient well-being. Moreover, the use of AI in healthcare raises concerns about patient privacy and data security. AI systems rely on access to vast amounts of patient data to function effectively. However, this raises concerns about the confidentiality and security of sensitive patient information. Data breaches can expose patients' private health information to unauthorized individuals, leading to privacy violations and potential misuse. Ensuring Robust data protection measures are in place is crucial to safeguard patient privacy and build trust in AI-driven healthcare solutions. Another challenge associated with the use of AI in healthcare is the potential for job displacement. As AI systems become more sophisticated, they may automate certain tasks currently performed by healthcare professionals, such as diagnosing certain conditions or recommending treatments. This automation may lead to job losses or changes in the nature of work for healthcare providers. Addressing these concerns through upskilling initiatives and creating new roles that leverage the strengths of both humans and AI will be essential in mitigating the impact of AI-driven job displacement. Despite these challenges, the potential benefits of AI in healthcare are immense. Early disease detection, personalized treatment plans, and improved operational efficiency can enhance patient outcomes and alleviate the burden on healthcare systems. By acknowledging these challenges and working to address them, we can harness the power of AI to transform healthcare for the better. Now let's return to the video, but here's the truth. AI won't replace doctors. Doctors who use AI will replace those who don't. The future of medicine is hybrid, humans and machines working together, faster diagnosis, personalized treatment, lower costs. It's not about taking over. It's about taking healthcare to the next level. We're just scratching the surface. In Sweden, a robotic arm assists surgeons removing brain tumors with millimeter precision. In South Africa, AI analyzes retinal scans, detecting diseases earlier than any specialist. In Singapore, robots dispense medicine, monitor vital signs, even comfort patients. No pill errors, no paperwork, just better care. But some fear that AI might take over. Let me tell you something. Yes, AI can analyze millions of scans, spotting tiny tumors we miss. Yes, it can predict your fall risk better than any physical test. But it can't replace the human touch. It can't comfort a scared child. It can't explain complex choices or build trust. The best doctors will use AI as a superpower, but they'll still need their intuition, empathy, and brilliance. Medicine is too human for AI to fully replace, but here's what AI can do. Imagine a world where cancer is caught early, where you never wait hours for a diagnosis, where a rural child gets world-class care from a chatbot, and drone-delivered meds. That's the promise of AI in healthcare, but only if we build it right. And that starts with awareness, like the one you're gaining right now. So if this video opened your eyes, like this video, comment your thoughts below. And most importantly, subscribe to this channel and turn on your notification bell so you never miss the next big breakthrough. We're just getting started.